All right, we are all assembled and ready to begin. Welcome to this County Board work session, our very first this year in consideration of the FY 2020 budget. The topic of our 2.5-hour work session today is our esteemed Department of Human Services. So let's get right to it since we're starting a little bit late. Turn it over to the manager for an introduction of the presentations.
Thank you, Mr. Chairman. I'd like to introduce our ardent and benevolent director of the Department of Human Services, who will make her own set of introductions.
Is that the benevolent dictator? Is that a euphemism for that?
That was understood,
okay.
not
All right.
spoken.
Kind and understanding, I think is what he meant. But good afternoon, County Board members and County Manager Mark Schwartz, Michelle and Richard. I'm here today in my role as Department of Human Services Director. My name is Anita Friedman. My partner here to the right is Deborah Warren, who is the Deputy Director of our Department of Human Services, as well as our Executive Director of the Community Services Board. If you indulge me for a minute, I'd like to present my staff to you, who are backbone of the Department of Human Services. Maybe you can rise as I say your names, okay? We'll start in the front. Corey Travis, who's our Finance and Management Budget Director and Management and Budget Chief. Dr. John Palmieri, who's the Division Chief for Behavioral Health Care. Kurt Larrick, who's Assistant Director for Communications and Public Engagement. Caitlin Hutchinson, who needs no introduction. Brooke Hammond-Perez, who's our new Economic Independence Division Chief. Jean Booth, who's our Chief of Aging and Disability Services. Patty Durham, who's Chief of Quality Assurance and Administration. LaVoice Reed, who's the Head of Developmental Disability Services. Maimuna Ba Duckingfield, who's the Customer Service Bureau Chief for Aging and Disabilities. Yan Ben, who's our Admin Officer for Public Health. Jessica Rooney, who's our Reimbursement Manager. That's it? And Jim Baker. And Jim Baker, who's Admin Officer for Aging and Disability.
Thanks.
Okay, if we could turn to the presentation. You should all have in your folders in front of you, too, the blue folders are a couple of handouts that I will refer to in a little while. Our Department of Human Services mission is to strengthen, protect, and empower those in need. And we take that very seriously. We serve approximately 50,000 residents of Arlington County every year. I'd like to highlight that on March 27th, we're going to be having our 50th year anniversary at 10 a.m. And it's going to be a big community celebration, and we hope to see all of you there to honor the work of our department through these past 5 decades. Next slide. I wanted to also report to you that although we see approximately 50,000 clients per year, there are some areas of services that are increasing in demand, and I just wanted to put them on your radar screen so that you know. Permanent supportive housing continues to grow, and we have some numbers of growth between fiscal year 2015 and fiscal year 2020. We've seen a 41% increase in clients being served through permanent supportive housing. School health, of course, as we provide the school health, the nurses and clinic aides to the enrolled students, has grown by 18%. We served 20,400 students last year. The Youth Mental Health Program, and thankfully you approved some additional resources last year for a youth mental health therapist. We have grown by 31% from 15 to FY20. And we continue to have more folks coming in because as we've implemented same-day access, people no longer have to wait for an intake. The same day you show up in our offices, whether you're a youth or a senior or an adult, you will be seen by a clinician. Next slide. Nursing case management, which is run through our, helps adults ages 60 and over, has had a 24% increase between 15 and fiscal year 20. And of course, unfortunately, but fortunately that opioid users are now going into Medicaid-assisted treatment that we have and have only had really in operation for the last 2 years, we've seen a 786% increase. Did I say Medicaid?
You meant medication.
Yes, medication-assisted treatment. It's an outpatient treatment system where we provide an alternative to opioids as well as therapy. Dr. Palmieri can tell us more. Next slide. Well, you've heard from us throughout the year, but I'd just like to highlight some of our key departmental initiatives where we are leading countywide efforts. Child Care Initiative, and you recently approved advertisement for changes to the county codes, chapters 52 and 59 for daycare centers and family homes. We are working to increase access, improve quality and availability of child care throughout the county. Destination 2027, we have had a year-long countywide effort to examine health disparities within Arlington and the causes of these health inequities. We are moving towards working to develop, hopefully, some adoption of policies on equity in decision-making within the government. Bridges out of poverty. We have worked for 2 years with 25 safety net nonprofits to make systems change to help the most vulnerable families become economically mobile. And we are now piloting a special program for the 200 most vulnerable families to do integrated case management with all of the nonprofits at the table. Racial equity. This year we will be launching a program to train our staff on institutional and interpersonal racism to develop a common understanding of the terms and the language that we use and begin to normalize conversations on racism and bias. And AC Works is an interdepartmental work group that has been inventorying the county government's workforce development services to identify overlap and gaps in service. Next slide. So our summary of proposed budget changes. Well, the fiscal year 2020 budget is $141.5 million. That's a $2.6 million or 2% increase over fiscal year 2019. Our personnel portion of that is $76.8 million. That's a $1.2 million increase or 1.6% from FY19, and our non-personnel is $65 million of that, which is 1.3 million above FY19. So we have an overall expenditure increase of 2%. Unfortunately, we have a revenue reduction of 1.5% down to 40.5 million. And that's largely due to the Medicaid expansion reduction that we'll be talking about later in the presentation. Although there are offsets to those reductions because we do envision increased billing in Medicaid, and we obtained some additional funding for RAFT, which is our regional mental health program for people living in nursing homes and assisted living, and we obtained money from the Department of Behavioral Health and Developmental Services for permanent supportive housing. Our FTEs are increasing by 3.05. That includes our reductions that you will go into of 5.75 FTEs, plus additional FTEs that the county authorized, county board approved in terms of Medicaid expansion and some projections we have for school health. Let's go into the significant budget changes. Okay. Back to Medicaid expansion, and you will see in your blue folder a handout called FY 2020 Medicaid Expansion Impact. So As you know, and have been brought before you before, there is a reduction proposed at the state level to community services boards across the Commonwealth in order to fund Virginia's Medicaid expansion that went into effect in January of this year. Arlington's share of the reduction over 2 years is $2.2 million. In fact, those reductions already started occurring in October of 2018 because there's a reduction of $600,000 or so in 2019. Now, on top of that, the county board approved an addition of 6 positions earlier last year in order to help process the new Medicaid applications. By the way, we have approximately 2,500 people newly enrolled in Medicaid in Arlington. Those positions were partially paid for by the Virginia Department of Social Services, but there was an additional cost to the county of $276,000. So the net, or say the gross, I should say, the gross expenditure of costs was $2.4 million, the revenue reduction and the cost increases. We do project that we will increase Medicaid billing because some portion of those new enrollees will receive CSB services. But at this point, we are projecting around $725,000 in increased billing, which means that the net cost for Medicaid expansion is $1.7 million, is what we're projecting. We don't have data that is good enough at this point to really accurately determine what percentage of new enrollees will be in CSB services, nor whether or not we will be able to bill for them. That said, the way that the $1.7 million reduction appears in the FY2020 budget, just so you know, we're covering half of that with one-time funding and half of it with ongoing funding. So $886,000 of it is in one-time funding in the FY2020 budget. Okay. School health, another handout. As you know, there are new schools coming on board, and we're excited. Alice Fleet Elementary School and a new middle school are among the ones that will open in the fall of 2019. When new schools open, our department responds with clinic aides and public health nurses who ensure that the students are seen in the health clinics when they need to. So we are requesting 2.55 positions. That is 1.55 clinic aides, and they have sort of odd FTE numbers because they only work 35 hours a week for 10 months a year. One for Alice Fleet and one for the middle school, and then we require, in order to keep our ratios of nurses to clinic aides, we're asking for a nurse position that would coordinate, would supervise those clinic aides. Okay, that's a total of 2.55 FTEs, $196,242. Housing grants, which we will get to later in the presentation. We have a section on housing. Is expected to, is projected to be serving 1,205 households, 1,205. In order to cover the costs of the housing grants budget, we will be requesting to add $779,812 for ongoing. And then there is an additional consideration of raising the maximum allowable rents. We'll get into that in a little while, what that means. That would cost an additional $548,000. So the total proposed FY 2020 housing grant budget is $9.3 million. Okay. The proposed reductions. The FY 2020 budget includes a proposal to reduce or eliminate 5.75 FTEs, 4 of which are filled and 1.75 are vacant, plus some other reductions amounting to a total of $792,480. Just wanted to let you know that we have had an extensive process in our DHS leadership since September, where we have considered a wide range of reductions, and we very much focused on those reductions where we could create efficiencies through merging functions or outsourcing work, where we would reduce services where client demand has decreased, and obviously also to do the least harm, to have the least impact to the direct client services. Here are the specifics of those proposed reductions. The first is a category of administrative reductions in the director's office. $100,000 has been eliminated from the budget to what's called the common area maintenance budget for Sequoia Plaza. You know that we rent Sequoia Plaza, and the landlord, luckily, revised the formula for calculating this annual fee for the common area maintenance, and it resulted in $100,000 savings.
Excuse me, was that at your urging, or was this something that was the regular course of their...
No, it's part of the formula that's utilized to determine, you know, where we expend monies and where they can, and the threshold for which they have allotted the amount that we usually need. Corey, do you want to mention how that's calculated at all? Corey Travis.
Hello. There were some lease negotiation changes that came about, and this was just part and parcel of that. So there's a, the way that's done, there's a ceiling for those charges that we have every year that was set at the base level when we first moved into Sequoia Plaza. And then once we hit that, we actually get a refund every year of everything we pay that's over that amount. So when you combine the changes to the fee calculation plus that refund, we can give about $100,000 for that budget.
Okay, thank you.
Okay, thank you. The director office also reduced its training budget by $50,000, and we eliminated a .25 organizational development specialist that was on staff. That's vacant. Next slide. I'm going to turn it over to Deborah to describe the next 2 slides of the proposed reductions.
Sure. So our Clarendon House program is our psychosocial rehab program for persons with serious and persistent mental illness. And that staff comprise about 9.5 FTEs. The number of staff who attend on a regular basis are about 100, and there's about 112 staff enrolled, but only about 44 actually, clients, but only about 44 attend on an average daily basis. So the reduction here is to eliminate a vacant .5 human services aide who provided case management support to the program. Things like scheduling, and those duties have been reassigned to existing nursing and administrative staff. We've centralized our scheduling, for example, to 1 FTE, so we were able to accommodate that. And that change reduces our budget by almost $40,000.
Next slide.
We also have a reduction in our senior adult housing funding. The first one is a reduction of 1 slot at Birmingham Green out in Manassas. That's a facility that has a nursing home on campus. We've been paying for 4 slots, and we only currently have 3 clients there with no clients in the wings waiting for services. So that's a reduction of $30,000. The remaining budget of $117,000 is sufficient to house the current residents. And then we have $10,000 in local developmental disability services funding, local funding, that has been supplanted because we received additional Medicaid waivers for our clients.
Next slide. Okay, the largest reduction in the Department of Human Services budget is to the Arlington Employment Center. And you'll see in the budget a county manager message about what we call the right sizing of the Arlington Employment Services. So, as you know, unemployment rate in Arlington has been under 3% for the last 3 years and went down as far as 1.7% in December of 2018. Last year, we demonstrated to you a decline in services that had occurred from 2014 to 2017 of about 40% of clients coming into the resource center, which is the first point of entry into the employment center. And yet again, from last year to this year, we have had a decline in customer services, customer visits by about an additional 29%. And there also, as a result of that, a decline in intakes and assessments, which is the first step of someone being case managed. That was a decrease of 33%. Last year, we reduced the Arlington Employment Center by 6 FTEs, and this year we are proposing an additional reduction of 5 staff positions, amounting to $533,615. What we have decided to do, given this decline in services, is to reorganize the employment center. The intake section and the resource center is really a self-service computer center where people are self-directed to sites where they can search employment opportunities, develop resumes, take online training, and that is going to be merged into our customer service center. That's the main entry point for clients into the department. That center already has under it entry points into housing, emergency assistance, public assistance, with a team of eligibility workers who already conduct comprehensive intake and assessment of customers. So we are adding employment to that array of benefits and services that our people will be assessed for through the customer service center. That allows some efficiencies. The efficiencies it allows is to eliminate the intake unit of the Arlington Employment Center. And the intake unit was comprised of 2 employment services specialists and a management specialist. Okay? The supervisor for that unit was already eliminated last year. So those are 3 FTEs that are proposed to be eliminated. We've also done some enhancement and moved our business development unit under the Alexandria Arlington Regional Workforce Council Executive Director, David Remick. And we've moved the Employment Data Administrator under that unit. That beefs up what that unit can do. But since we had 3 employment development specialists on staff who are responsible for organizing job fairs and connecting clients to employment, we have suggesting the elimination of 1 of those 3, leaving 2. Furthermore, by doing this downsizing of the AEC, which was considered a bureau with a bureau chief, Howard Feldstein, you may remember, just retired. And so we will be eliminating his position, and the remaining supervisor will report directly to the EID, the Economic Independence Division Chief, Brookham and Paris. We are not there's no impact on any of the employment services to those who are in TANF, and you know, there's a VIEW program that's the state mandated employment piece of receiving temporary assistance to needy families. There's no impact to WIOA, no impact to SNAP. And we hope that this will be the right size for the meantime until we do further work through our interdepartmental work group to see what other services can be combined with other departments or with nonprofits. Next slide. Okay, that's the end of our reduction piece. We did want to alert you to some nonprofit requests that you may have already received in your offices. There are three to mention. Doorways for Women and Families is requesting $46,000 increase to their domestic and sexual violence hotline contract. You may remember that when we first funded the Doorways Hotline, and that was under the leadership of Katie Crystal, who's the Project Peace Coordinator, or liaison, I should say, we had very poor data on what volume was really coming into the hotline, and that was in 2015. Well, since 2015, our calls have increased by 105%. So in 2018, we received on an annual basis 2,390 calls. So the additional calls is the basis for this request. The calls also have resulted in an increase to sexual assault assessments and accompaniments when victims are accompanied to Fairfax Hospital. Those increased by 1,400% from 4 to 60. AFAC has asked for an additional $50,000. Their contract is currently at $477,925. We only pay for the purchase of food. We do not pay for any administrative costs. There was a slight decrease from fiscal year 17 to 18 in their numbers, but they are anticipating that in fiscal year 19, which is not yet over, their numbers will increase by 6%. And finally, REAP. Now, you remember last year we did decrease REAP by, I think it was $160,000 in their administrative side of the House. That did not result in any decrease in slots. In fact, this year, they have served 9.7% more people than they did previously. What they are asking for and what they're interested in is conducting a CDA program being the Child Care Development Associate credential that you heard about during the Child Care Initiative. They feel they're uniquely positioned to offer this program for people who are English as a second language speakers, because some of our family daycare providers are limited English. However, there are a number of other providers that can offer CDA training, including Northern Virginia Community College, and we've looked into the possibility of actually using some other sources of funding like WIOA to pay for individuals who want to get their CDA. Okay, I'm turning it over to Deborah again.
Okay. The Community Services Board, as you can see from the numbers that we've indicated, is concerned about increasing demand for individuals needing substance use, mental health, and emergency crisis intervention services. DHS has made a significant effort to use existing resources in various ways, for example, reallocating overtime money to create an additional emergency services position. We still have a significant need for therapists. The request from the CSB is 2.5 FTEs, which amounts to $264,000. They include a full-time therapist who would be focused on treating persons with substance use disorders, as well as specifically opioid use through our OBOT program. The percentage of clients who are coming in for substance use treatment has increased with same-day access, which makes sense if you can get treatment that day, by 20%. And as you heard earlier, the number of clients that we are seeing in the last 5 years with opioid use has increased really close to 800%. The second request is for a half-time therapist that would augment another half-time therapist to create one FTE for clients with autism who also have a behavioral health diagnosis. We have currently in our system 75 clients on our developmental disability services side with co-occurring diagnoses, and then we have another 15 clients on our behavioral health side who have co-occurring diagnoses, and we're very challenged with that care. And then finally, an additional therapist for emergency services to meet the increased need in that area. One indicator of the increased need in that area is temporary detention orders have increased by almost 30% in the last year. Okay.
What diversion?
Okay.
Sorry, Mark wants to say.
I actually just wanted to notice something, which we've included these requests from nonprofits and CSB in the slide presentation because you received them. And well, two comments. One is, several of them I think you've heard Anita say she thinks perhaps aren't warranted, but some we would say are needs. And since we just received them, you know, DHS does, I think, a very good job of work. We'll work with the CSB and the requesters to see if there are ways to meet the needs within our current program complement. And if not, if we need additional funds on that, I know you traditionally will ask me as we get towards the end of the process, are there things that we've heard about that require additional funds? This could be, include some of those. And I would note that there are some potential sources of funding related to, I'll speak in a little bit of code here, potential leaseback opportunities and revenues we're going to get back on some property that might be able to provide some bridge funding on some of that. So it's, you know, we bring them up because we think it's important to at least articulate what they are, because some of them, for example, like the doorways request and a few of the others, I think really are legitimate needs and increase in demands.
Thank you. So we do constantly look for alternative sources of funding beyond local tax support. And I did want to report on that on Diversion First, which, next slide, please. So Diversion First may be familiar to you as a result of the negotiations with the Virginia Hospital Center. There were a number of things that were worked out with regard to behavioral health. And with regard to children, we were able to work out an agreement that the hospital would fund a full-time therapist or provide a grant of $100,000 a year over a 5-year period to pay for the bulk of a mental health therapist. And the agreement is that the target population would be young people up to age 22. We decided to expand that beyond 18. Being mindful of first episode of psychosis. And these would be young people who present at the Virginia Hospital Center Emergency Department and our own Crisis Intervention Center. And the therapist would provide assessment, crisis stabilization, intensive care coordination, linkage to other services to divert youth from actually being psychiatrically hospitalized. And we're going to be working collaboratively with the hospital center on tracking a number of data elements and really paying attention to the outcomes, and may propose a locally funded program in the future when the grant ends. Right now, that position is in the process of development through our Human Resources Department, and we hope to get that program up and running by the end of this fiscal year.
Next slide. Shall we go on to DHS housing? Okay.
Why don't we pause for questions here, since you've given us a nice chunk, and we want to make sure those don't get lost before we move on to housing. So, Ms. Garvey.
Yeah, I had a couple, but maybe I won't do all of them right now. On the tremendous increase in opioid demand for treatment, did that mean that other drugs needing treatment went down? I mean, is this a replacement, or was it purely additive to what we've had before?
Why don't we ask Dr. Palmieri?
Dr. Palmieri, can you come up and speak to the opioid treatment program?
Hi, good afternoon. So to answer your question, I mean, I think it's a little bit of both. I think there's definitely been an increase, as we've seen nationally, in opioid use disorders and opioid use treatment needs. So that, I think, has been a kind of epidemic that's developed even outside of any other kind of factors that might be driving substance use. So I don't think it's really a question of it replacing other things necessarily. We're still seeing high levels of alcohol use, high levels of cannabis use, particularly among younger adults and youth. And so I would not say that it's a replacement necessarily, but it's something that has been a progression of substance use disorders and also has kind of become its own sort of entity in a way, and has kind of skyrocketed out of control.
Oh, no, it clearly has. So, like, you know, we were concerned before there was opioid use. I mean, they're all, I mean, not opioids, I was thinking of heroin and think, you know, the old-fashioned drugs. And so I'm wondering, you know, is there a segment of the population that, you know, uses drugs and needs support, or is that segment increased? And what I'm hearing from you is it's actually additive, so that people are continuing to use other things, and new people are using these things, and it's all going up.
Opioids does include heroin and.
Oh, I'm sorry.
Yeah, and fentanyl, which is.
Yeah.
Yeah.
Okay.
Yeah, so I think that's right. I mean, I think it is additive in the sense that there's, you know, kind of a baseline utilization of substances and a baseline incidence and prevalence of substance use disorders, and this has really kind of amped that up exponentially, really, due to a number of different factors.
Thank you. I was just trying to figure out.
Yeah, but the Medicaid-assisted treatment program, just talk a second about that, is something new that we did not offer before.
Right.
Tell them what that is, John.
So medication-assisted treatment is part of the Office-Based Opioid Treatment Program, or OBOT, so that's what OBOT stands for. And that is primarily using medications, FDA-approved medications, Suboxone and naltrexone, primarily to treat individuals with substance use disorders. There's been lots of evidence to suggest that the outcomes in terms of morbidity, mortality, time to relapse are significantly better when people are engaged in that type of service.
Okay.
And we introduced something similar in the jails, right, with Vivitrol.
Yeah, it's been part of the work of the RE group to, you know, that sort of community stakeholder group to really look at all different types of opportunities to improve the service delivery. And so when people are incarcerated and released from jail, that's a very high risk period of time just because their tolerance has been decreased. And when they leave the jail and attempt to use at a rate that they had been using prior to incarceration, that can obviously be very risky. So we now have a program in combination with the sheriff to identify individuals at risk who can receive Vivitrol treatment in the jail and then transition to care at the CSP once they're released.
And hopefully then they stay on Vivitrol and care and they don't go back to using.
Correct. I mean, the benefit of Vivitrol is that it's a once-a-month injection, so it does provide a bit more continuity in terms of the treatment piece during that transition period, which can be pretty high risk.
Thank you. Could I have one more question, then
Sure.
Is that all right? A different subject. Thank you very much, Dr. Palmieri. Just on the autism and behavioral health, is there still the gap where children with autism are you know, receive services through the school system, and then they leave the school system, and there's this gap before they actually either, I don't know, qualify or get to our services, and I would guess if they're mental health and behavioral health, that's where the real problems start happening. And are we doing a better job preventing that gap of services?
I can't say that we're preventing that gap in services, but we are very attuned to that gap, and we are doing a number of things to try to address those needs. We just sent 13 CSB staff across divisions, including developmental disability and behavioral health and child and family, to a 3-day training this week on co-occurring autism and behavioral health so that we can get more co-occurring treatment capability. We also have staff meeting across behavioral health and developmental disability monthly to talk about those joint cases. We also are meeting with the school system. We just had a 2-hour meeting with the school system with the head of school counseling, with a whole group of people actually on Friday of last week, and we plan to meet with them monthly. this will be one of those agenda items.
Is it getting so there's like a handoff, like because the families are looking for help, there's actually sort of a handoff, because I think before they kind of like said goodbye.
It's getting better.
It's getting better,
The
but.
main issue was within our own department, we had siloed, developmental disabilities and behavioral health. And people with co-occurring autism and mental health don't fit neatly into either one of the buckets. So we're doing a better job at training up our staff to be able to work when there's co-occurring disorders are present.
Okay, great.
And the needs are very unique. In other words, there's no sort of template for treatment or best practice. There's lots of individual variability in what they need.
Which is why I think people need a real, they need like a handoff, or you're always, because it's just too hard to be left on their own. I'm sorry, thank you so much, thanks.
Thank you, Ms. Crystal.
Thank you. So a couple questions about the major change in this budget with the Arlington Employment Center, as well as I do have a couple questions about nonprofits, which I'm happy to ask immediately after or hold till other colleagues have an opportunity. First, just really appreciate your comments and about the affected employees, et cetera. And I think just an observation that it's really easy for us to assume that we either have budgets that are being added to or we're in a year of cuts. And this is a really strong example of how even a budget growing by 2% and 3 FTEs still involves really hard decisions. And so really appreciate the team's willingness to do that. And I think, as we've said last year, this is a very evidence-based way of going about it, seeing and responding to trends in our community. But I know that does not make the news any easier for affected employees. So I wanted to ask a little bit, you've shared a really helpful background on the sort of strategy here about how the self-service operations will be affected, sort of the downsizing of AEC from a bureau to a function within economic independence. One relatively technical question that I had, though, as Director Freeman was explaining, there won't be changes to services where participation in unemployment services is a requirement of TANF, et cetera. Is that also true for Medicaid expansion? Because I know it was a provision of the state's Medicaid expansion that individuals, and we now have, we use 2,500 new Medicaid eligible who are, as a requirement of state law, need to be enrolled in some sort of either work or work-seeking programs. Do we believe still that with this change in approach, we can meet that requirement for those individuals too?
My understanding is that requirement has not gone into effect yet. Okay. And in fact, Virginia was requesting a waiver from the federal government to not have that requirement go into effect.
Oh.
It could be a concern for 2021, but I have to tell you that even with the reductions that occurred last year and this year, and it is basically a 30% reduction to the overall Arlington Employment Center staff, we still have, I believe, 10 employment services specialists on staff. There's a good core that remains. And
so even if Virginia does not receive the waiver and such services do need to be delivered to some share of those 2,500 or more new enrollees, possibly have the core of people to still deliver them?
I hope so.
Okay.
You know, I can't project how many of those 2,500 will be in need of employment services, because there are quite a few who are already working.
Yeah,
also.
that's right. So it's almost like work requirements are politically motivated and not grounded in smart public policy, but I'll avoid speculating too much further. So that was my more technical question, and I think that the more kind of strategic or overarching one that I wanted to ask about was, I know this was described, I believe it was in the manager section of the budget, about sort of pursuing more opportunities to co-locate services, coordinate with non-county entities providing employment services, and maybe focus the services on the high-need population. So, folks with the developmental disabilities, serious mental illness, other barriers to employment. I wondered if you could maybe say another few words about the strategic approach there, how such plans would be developed, who steers them, how they'll be monitored, whether there are geographic approaches as well as special population approaches. A lot of what's motivating my asking this is the work that your department is in fact leading on, which is more, better decision-making framework on equity, racism, bias, et cetera. So to the extent that there are pockets of our community that are disproportionately impacted by unemployment, how does that factor into the kind of re-strategizing the future of the Employment Assistance Center?
Well, I'm glad you asked. I just sent Mark, our our initial report on AC Works. So David Remick, who you probably know, who is the Executive Director of the Regional Workforce Council, is leading an interdepartmental group, and I believe there's 13 members, including libraries, DES, let's see, CPHD, Arlington Public Schools, a whole bunch here. Let's see, Job Avenue, Biz Launch from AED. So he together developed an inventory, which I'm happy to send you after the county manager approves it. Which basically inventoried, who's doing what and with whom. And we do have some overlaps, and so those overlaps have to be looked at in terms of who's in the best position to deliver that service and who are they targeting and really reaching. And we have not done all the thorough, it's a preliminary inventory, I just want to let you know. So for example, libraries has workshops on resume building. Well, so do we. So who should be taking the lead, who should step back, and how they could be combined. We also realize that we have some tools within the Arlington Employment Center that we have not shared with a lot of the different entities. So for example, we have a job board, an electronic job board where employers post positions on there and people can post their resume. We haven't shared that across the different departments. That's something that we plan on doing. We're looking at even creating some training programs that potentially have revenue generation, although I haven't seen the numbers, so.
Don't get too excited.
Don't get too excited. Where, for example, there's a scarcity of commercial people with commercial driving licenses. They're in high demand. And with Amazon coming, they'll be even in higher demand. So the CDL, which is the commercial driver's license, that's a potential for us to develop a training program that could even serve our own employees, like the DES employees who have to have that, and Arlington Employment Center customers. Some of those are not native speakers of English. We could potentially bring APS along to do some kind of program. So these are the kinds of strategies that we're considering. We have not, though, sort of looked beyond our interdepartmental programs to then bring in the community programs, because then there's another circle around that of Goodwill, NOVA, Northern Virginia Community College, Doorways, Bridges Independence. So it's going to take a little while, but we're trying to identify where collaboration can be created to create efficiencies or sharing of resources, as well as identifying gaps. We are trying to work more with populations in need. So for example, internally we're connecting our AEC people with Job Avenue, which is our behavioral health care division's supported employment program, and we need to do more in terms of supporting the developmental disability community as well in their need for employment. So those are some of the things.
It's helpful, thank you. If I might, just on one related note, and then I'll yield the floor. Speaking of job opportunities in addition to CDAs, I wanted to just clarify something that you were just saying about REAP proposed that they could offer a CDA program for ESL learners. You'd mentioned there are other providers, and that preliminary thinking is we might be able to use some WIOA money to pay. So to clarify, we could maybe use WIOA for scholarships at existing programs, but not to stand up a new program. Am I inferring that right, or is there more research to be done?
No, I think WIOA can be used in both ways. It depends how we want to do it. We can identify individuals who want to take the course on their own time and identify who are the WIOA approved training entities that can provide it, and then pay those training entities for the individuals. We can also stand up our own training.
Okay.
And I think use some WIOA funding if we have enough, critical mass,
Okay.
and pay a vendor out of that. I do.
If I could make a request for follow-up, knowing that we'll be seeing more about this request, if there's a way for us to use WIOA money to support a known program in Arlington County and a known need in Arlington County, I'm very interested in hearing more. So I'd love if that can something that we could explore and get some advice on.
Thank you, Ms. Crystal. Other questions? I'd like to follow up with some of the employment center conversation. So you're at the point now where with full employment and the nature of people's access to services that you're identifying that the clients that you're serving are the harder to employ.
Correct.
So given that the model has effectively been what can we do to find people a job, I'm wondering if there's any new thinking with your program, what do you call it, your performance metrics, which you're so innovating.
Planning?
Your performance measurement plan, thank you. If you're beginning to think about some other ways in which people might be supported, the underemployed, for example, who may already have jobs but need pathways to better ones, people who are cobbling together a couple of different gig jobs in order to make ends meet. Just are there changes in the spectrum of what we might offer to be of more help to Arlingtonians?
We need to. We haven't, I don't want to say that we've done a good job. I don't think we've done a terribly good job. We sort of built the kingdom, and said, here, you can step through the door and we'll help you. And we need to go to a more of an outreach-based model. Something I think that's heading in that direction is the Bridges Out of Poverty group, is working right now with 50 core families, very vulnerable. And so one of the identified gaps for them, of course, is employment. And so we have a job fair specifically targeted in, what month is it, Brooke? Yeah. March at Arlington Mill for those people who are in Bridges Out of Poverty, who are some of the most vulnerable. So taking our employment services out to the community, I think is going to be a strategy that we need to do in order to reach, especially communities that don't want to come to our building anymore for different reasons,
Good point.
I applaud you for thinking that way when you've got something that's institutionalized as a model delivering services one way and the economy and employment has structurally changed.
Yeah.
I applaud you for thinking about how to move together differently, but while having the courage to not just continuing to doing the model at the same size as always. Ms. Garvey.
Just continue a little bit on the same note, because this whole pilot that you're doing, it's about more than jobs, right? I think you're doing all of this. It's actually really exciting. And I was just wondering, I don't want to take up too much time now, but I assume, it's a pilot. You're going to be probably doing a report and coming out. When can we probably see the results? And
we wanted to, it got past me, but we would like to come and give you all a presentation, because we've done 2 years of work.
Wow.
With 25 of the safety net nonprofits. I mean, AFAC, Doorways, ASPAN, Free Clinic, they're all involved. And we did a whole bunch of systems reforms. Before we did a training led by Gene Booth and who had gone to the out west to get the original training. We trained people in the concepts of different ways to look at poverty and class. And then we actually worked really in detailed work to develop these kinds of tools that all of the nonprofits and DHS can use. Right now, we've established a universal release of information form.
Right.
This may not seem like much to anybody.
Something everybody would assume you had already.
Everyone had their own form, if to get the permission of the client to allow us to talk to each other. One agency had one form. We had within the department, I don't know, dozens of forms. We've all come together and we have one form where someone can allow the entire network of DHS and all the nonprofits to sign off and share their information in order to improve their, without violating HIPAA, approved by the county attorney's office.
Wow. Thank you. I would love to get a briefing on that. And I think I remember you coming and talking to us about doing those forms some years ago. Anyway, I would love to learn more. This probably isn't the spot, but it's really exciting, and I'm delighted to hear how much progress we've made. Thank you.
Good.
All right, any more questions on this section? Ms. Crystal?
I just wanted to ask a little bit about nonprofits, if that's all right, not too extensively, but one of the things we've talked about a lot is sort of trying to sort through the many needs of nonprofits in our community, including those who already receive support from the county. I think that there are a couple of examples here, Mr. Manager, as you were indicating, where we've seen extraordinary growth in services. True for Doorways, maybe a new opportunity that Reeves brought to our attention. There are also a couple of entities that we, rightfully so, because they're doing a great job advocating for their work and their clients, but we see every year, irrespective of whether their trends and services are going up or down. And so, one of the things we've talked about a lot is maybe not wanting to open the floodgates to infinite asks, especially in times of relative constraint. But I wonder, it is interesting to me, I know that AFAC is not the only nonprofit in our community that would benefit from an increase in services. Many have, or funds, many have talked about, things being flat. Could you just give us some insight into what direction beneficiaries of county, I'm thinking especially the community development grant funds, et cetera, were given in terms of submitting asks this year, just so we know a little bit on the background of what those conversations looked like before they got to the board level?
The guidance was, we don't have any money. We don't have any increases for you. Any additional money. I have a handout here just so you know that, and this is just my own reference, we have, I would guess, at least $10 million probably going to safety net programs in terms of funding. Now, we haven't increased on a routine basis at a certain percentage level those budgets for many, many years. Some neighboring, I was in a meeting yesterday with some of the neighboring jurisdictions who do have in their budgets like a flat percentage annually that they give to the nonprofits. We have not had that approach. We have always had the approach of, well, let's see who needs what. But it's not really an equitable system because the squeaky wheel does get the grease. I'll turn it to the county manager.
So yes, because I'm an expert in squeaky wheels. Is that right? I want to go back a couple of years because, and I think that Mrs. Garvey will remember this, and Ms. Crystal and Mr. Dorsey on the board, which is that you actually tasked us back in 2017 with doing an inventory of all the nonprofits in the county to try to come up with a way to compare our practices with other practices around the country about how funding decisions were made. Not just this question about providing adjustments related to the fact that nonprofits hire people and they need to pay them more. But what we did, and I want to give you an update on it, we did an inventory back in 2017. It has sat for the last year and a half. And we need to, and I'm committing right now to going back and refreshing that inventory. We went back and we said, we added up all the funds that go to nonprofits. And in the county budget, it's about $27 million. So 90% of that is in DHS, and some of them will be, that includes the regionals, I think. So, yeah.
And some of them are contracts for services where we, intentionally, via competitive process, outsource.
Right. So, with DHS coming around, sort of wrapping up a little bit on the child care initiative and Destination 2027, and we have some resources that are freed up, I think we have to go back and actually engage in that best practices analysis to see how it's done, survey other jurisdictions, and then develops a scope for follow-on work, which is going to, and it must involve the nonprofit community, rather than us sitting around sort of figuring out what makes sense. And I'm hoping in that way, this isn't meant to put off the question, but I think we need to, and rationalize is the wrong word, we need to figure out whether we want to have an approach that we try to apply across all the nonprofits, a similar approach, and include in that the kinds of adjustments we need to make for those services that we think are important. Because we have not, I think over the last 4 years, made any of those adjustments, and it really has been a squeaky wheel approach and a legacy approach. There are some organizations that continue to get funds that neither this board nor our management team has spent a lot of time focusing on, so.
Well, I appreciate that, and I am interested in the more comprehensive look. In the meantime, I also want to make sure that we're not penalizing nonprofits that are following the advice and recommendation of our DHS staff and saying, you know, we'll try to find other sources of money or forego increases this year, you know, and then the squeaky wheels went out. So that's to the extent you have more to shed into our decision-making this budget cycle in that regard, I would welcome it and appreciate the commitment for more comprehensive work ahead.
Thank you. All right, so, you know, I see that, oh, Mr. DeFerranti, yes.
Two pretty quick questions. One, just I would be interested in that additional information that Ms. Crystal just described. And I just want to track to make sure I've got the history right. Not last year, but the preceding year, AFAC had seen a fairly sharp increase in need, and there was the one-time discussion that I got the glory of watching on Arlington TV. But is that accurate, that that was the sort of past 2 or 3 years?
I think up until 2017, I mean, the real spike, of course, for AFAC and for the rest of the safety net nonprofits occurred around 2008 when we had the real estate, the housing problems. But
sure.
They've gone up 2015, 2016, 2017. 2018, they had a slight dip. What happened with AFAC is that we had been giving them, I think for 2 years, we gave them a one-time supplemental funding of $50,000. Both in 17 and 18, they got that. In 19, we didn't put it in because we were in this budget cutting mode, and we haven't put it in for this year. But the numbers, we don't have the final numbers for fiscal year 19 yet to know whether or not there was a trend upwards. So.
Sure. Well, I'll be interested in the process and learning more. I also will want to follow up on that, given the preceding years. Second question is just to Mr. Dorsey's, to the chair's comments a little earlier on the Employment Center. Thanks for your leadership. I'm mindful that, of course, the positions is hugely impactful, and I don't want to diminish that, but thanks for your leadership on it. Is there training that would occur as you go into the plaza to the right in the intake center? Would there be some training to make sure all the folks on that side know what the new process is? And then just so I understand a little bit, as you go into the Employment Center facilities to the left, there's still going to be, of those 10 staff, there's still going to be individuals to work with. It's just, it would be reduced staff on that side.
Correct, yes. The customers, we're not quite sure where everyone will sit yet and how it'll be configured, but the customer service center staff will be trained up to deal with the employment intakes. We may have some of those people sitting on the left side rather than the right side. The resource center will still be open for business. But the resource center was overstaffed, and so now we've pared back what they really need.
Great. For those hardest to employ, I want to make sure that there's that personal touch to they can get.
I'd like to add another dimension to this work with nonprofits and thinking of them as a vendor on contracts. And what's our approach to determining when we renew contracts to update new employment conditions, new standards in the marketplace, new programmatic outcomes that we want? Do we have a regularized system of looking at making sure those are aligned with our overall budget goals and priorities? It seems unclear, just from my perspective as a board member. It seems like we've got a lot of different ways of doing it across our various lines of business, and tell me more. This is an invitation to tell me more. Lead the discussion.
Do you really want to know?
I do.
So, you know, within the Department of Human Services, we have contracts that are competitively bid. Of course, those are sometimes in the minority because of the time-consuming process of issuing RFPs and going through a whole purchasing process. We have some that are just sort of grants that have been given over time, you know, and Northern Virginia Family Services for pieces of work that in the past were deemed important. And then we have sort of more fee-for-service types of contracts with nonprofits, where nonprofits actually, you know, run a group home, and depending on how many people live in that group home, they bill us, or, right? We have ones who provide foster care therapeutic treatment or whatever kind of need that our clients have. So it's a mixture. So you can't just sort of defund everything and then start over, because we are required to provide certain services to the community and to the residents that we don't have internally, and so the nonprofit providers really provide a complement to our whole continuum of services. That said, each contract has been created over time with a scope of work that depended upon whoever wrote it at the time that it was issued. Now, we've been systematically trying to, over time, improve our scopes of work when they get renewed to have more outcome-focused measures rather than inputs, you know, not how many people did you train or how many people slept in your bed, but what happened as a result of that in terms of the outcomes of their well-being. But and we actually have an internal person now, we never had that 2 years ago, who looks at language in our statement of works and tries to streamline and train our internal staff how to write appropriate statements of work. She works for Corey. How to format everything, how to work, you know, smoothly. We just developed, actually, a pilot contract monitoring tool that we're interested in rolling out. But we did this ourselves. Corey did it with all the admin officers, where we would be conducting routine sort of visits, monitoring visits, to be able to see how our contracts are faring on a whole range of issues in terms of their financials, you know, solvency, their boards, and the oversight of the board of the agencies, and a whole bunch of things. But we're in the process of discussing that with purchasing to see whether we could roll that out.
It seems like we got some robust areas of work here that
yeah,
you know, might be necessary, and more on that later. Any other comments on this section? So I do want to ask, I know we have Mr. Staterman and Ms. Herman here from the CSB, and I know parts of what you may have been interested in commenting on have been a part of the first presentation, but I'll leave it to you as to whether or not you want to wait until after the housing presentation to give comments, or if you'd like to do it now. Mr. Staterman? I'm sorry to have you make choices, I know. You'll wait for the housing one? Okay, Ms. Herman? Okay, thank you very much.
So we'll be quick. Okay, so we'll turn to our housing programs, and I'll try and do this quickly so we can get to all of the commissions. We only have a few slides. Okay, housing grants, we always update you on housing grants, and here you can see a graph that shows from fiscal year 15 to fiscal year 20. You know, a decline, which we reported to you before about the numbers of households receiving housing grants. It's not a decrease in the number of, it's a decrease in both numbers of applications and households receiving. It's not due to any more rigorous application process. However, as the numbers have gone down slightly, our household cost per household has gone up. And if I can refer you to this in your packets, in your blue folders, it's a handout with an orange line in through the middle. This shows you the history of the base the budget, the expenditures, the numbers of households served, and the cost per household. And the cost per household has gone up from $583 in 2015 to $650. That's why we are now projecting that we will need $9.3 million in fiscal year 20 to pay for these for the housing grants program. However, next slide, we have included something that I think is very important in terms of housing affordability and allowing these housing grants families to actually be able to lease up an apartment and afford to, the rents of these apartments, and that is an increase to the maximum allowable rents. What does that maximum allowable rent mean? It means that when you lease up a 1-bedroom, 2-bedroom, or 3-bedroom, our housing grant program will only be able to consider payment up to a certain amount. That amount had not increased since 2010. Rents kept growing up, but we did not increase the maximum allowable rent. Housing choice voucher at the federal level, they increased. We didn't increase. So what we found out is now in this year, we have over 40% of our households in housing grants who are contributing more than 40% of their income towards rent. And you know that housing affordability is typically defined as a household not spending more than 30% of their income towards rent. So here we have 506 households now that are paying more than what they can afford to pay. So the maximum allowable rent, as you can see there, is recommended to increase to the level of 60% area median income rents. So those amounts up there are $1,319 for 1-bedroom, $1,582 for a 2-bedroom, and $1,828 basically match what a 60% area median income rental unit would cost. So, next slide. Here is basically a graphic image of where our current maximum allowable rents are. That's the blue, what the proposal is in the orange, and then the HUD, current HUD fair market rent is what they call it for Arlington. That's a lot higher. We're not proposing that we go that high, although the Housing Commission has flirted with that proposal. That would entail an additional $4.7 million. Next slide. Okay. Do I need to say anything else about housing grants? No. I'm going to permanent supportive housing. I wanted to let you know that permanent supportive housing is a program that provides not just a secured unit and rental assistance to people who are permanently physically or mentally disabled, but also wraparound services. We have been increasing this program steadily. We're now projecting to have 265 available units in 2020. That, of course, depends on whether Gilliam Place opens on time. The average monthly grant is deeper for these units than for housing grants. It's $909 per month. The costs that we have, or rather the budget that we have in our DHS base budget has been flat. I don't know, even before 2017? Since 2015, we've had $2 million in there. $2,064,870. We've been overspending because the units keep increasing, but we haven't come to the board for additional, we haven't come to the county manager, I should say, or the county board for additional funding. We've just been absorbing it in our bottom line. And we will be absorbing again in 2020, $237,000. But by 2021, we will probably be presenting a request for some additional funding in order to keep up with the cost of this growing program.
This is a heads up.
It's a heads up. And that concludes my presentation.
Thank you very much. Ardent and benevolent one. We appreciate it.
I think they'll call me AB.
All right, let's do some questions on this issue before we go to our commissions. And Mr. DeFerranti.
Just quickly, thank you for bringing forward on the housing grants. I know Mr. Leibson is here and has spent a long time mentioning housing grants, and so appreciate it. At the Tenant Landlord Commission, the proposal to go all the way to the 30% HUD's level was talked about. I'm glad that there's an estimate as to the cost. I'm mindful that step by step is appropriate, so appreciate you bringing that forward.
Thank you. Ms. Crystal.
Yes, so I want to make sure I'm understanding how much an individual family or household receives, or an individual receives in their housing grant is a function both of the maximum allowable rent and then their income?
Correct.
So are there any changes proposed here to the income limits?
No.
No, so it's the same families who are now eligible to receive greater increases?
Correct.
Okay. One thing that would be helpful to me to just sort of think through this a little bit more is if we could if we could see a couple of examples of, for a client family in a 2-bedroom apartment or a 3-bedroom apartment, how much the change might be for them. That's what
the orange piece is. You see the little orange above the blue on each?
I see, okay.
Okay, so the blue represents what they currently receive. The orange is what they will additionally receive in terms of the maximum amount.
I interpreted this as the change basically showing that we were covering the change in the 60% CAF rent. But that's the point, is they're kind of indistinguishable as 60, the amount of, okay.
Right.
That's helpful to me.
So if you're in a 2-bedroom, previously the maximum allowable rent you could have was $1,344. Now it's going up to $1,582. So it all depends on your income too, because you still have to, same income level,
Right.
same requirement that you contribute 40%, not more than 40%.
Okay.
And whatever the difference is, though, people typically have been absorbing themselves in the past. Now we would be providing a little extra money.
So I want to make sure I'm understanding then. So the idea is by providing the extra money, we hit our target of they're only spending 40% of their income.
Correct.
Okay. So the other thing that seems helpful.
30.
Excuse me, 30%.
40.
It's 40.
Oh, for housing grants, right.
I think 30 for,
Right.
And the other thing that this should do is make sure that there's nobody in a CAF where the rent of that CAF exceeds the maximum allowable rent of our housing grants program. Is that right? Because we'd gotten out of step in that regard, hadn't we?
sorry, can you repeat that?
Sure. So we had CAFs in the county at 60% whose rent being charged monthly exceeded the maximum allowable rent of our own housing grant program.
That's right.
Okay, and this will correct that.
That's right.
Have we considered at any point, or I guess what would it be required to make it a matter of policy going forward that we don't have CAFs and housing grants get out of step like that?
That's a great idea.
And discussed with the manager.
It has been discussed with the manager and is under advisement. Okay.
Came up at Housing Commission and landlord-tenant.
Yeah.
We wouldn't have this, waiting to, having this years of distance between what's the current maximum and what the 60% is. Yeah, it should go up every year according to.
Yeah.
A year or two, yeah.
Yeah, I'm certainly.
A biennial look, but that's just
I
me.
certainly think it's worth looking at. I mean, I assume at this point it is very hard for anybody to be at market rate housing with a housing grant.
Right.
And so this is sort of becomes the very least we can do is to make sure that the apartments that we're subsidizing by matter of policy.
Right. Well, also 94% of people in housing grants are in CAFs. Okay, there's not many that are not in CAFs. And as CAFs come on board, we typically get little bumps to the housing grants program. Another thing that happens, and that's partly why the trend has not been constantly increasing housing grants, is that when there are housing choice vouchers opportunities that come open, like we had the redevelopment of Culpeper Garden, and there were a whole slew of project-based vouchers that came open, people who had been in housing grants in Culpeper moved to the housing choice voucher program because it's a deeper subsidy. So there's movement between
the programs.
Yeah,
well, that was a little bit of the question I wanted to ask is over the past couple of years, as this gap has opened up between our CAFs and our maximum allowable rents with housing grants, what I think you were just answering this, Ms. Freeman, but what that has meant for the people who are in a CAF with a housing grant, they've just personally had to make up the difference.
Right.
But there's not like a cliff, for example, where you lose your housing grant if you're suddenly in an apartment that's ineligible for the maximum allowable rent.
Well, when people apply, we typically advise them to stay within the range of what the maximum allowable rent is, if they can find it, or if it's a little more, and we assess what we think their financial viability is to pay for it. If it's some crazy amount of money, you know, because it's a luxury apartment, we will typically not approve
The housing grant. But that's a decision left to the discretion of the caseworker.
Well, it's, I don't know the exact formula that we use, but it's, you know, I think it's on at the assessment point of the viability of the person to have a steady income to pay for
Okay.
the unit on an ongoing basis. Am I right, Brooke? Come forward, Ms. Hammond Perez, and experience this awesome.
So, yeah, right now it's like, for example, 1,189 for a one-bedroom unit. Depending on the client's income, we might go up to like 1,250 when we approve it. But if, like Anita had mentioned, if it's way out of range, I mean, there's a little bit of leeway, but mostly it's depending upon the discretion of the caseworker to determine that leeway. But if it's way out of range, we're not going to approve it because it's not reasonable for the client.
What I'm most interested in is not when somebody comes and says, I found a luxury apartment and I'd like housing grants to subsidize it, but when someone has been in a CAF for a number of years, that CAF rate has increased. Is there a point at which an eligibility worker would say, you're no longer eligible for a housing grant at all? Has that happened?
It has happened, yeah. I mean, plus it has happened that affordable housing providers have raised their rents themselves, and our folks who are on housing grants and housing choice vouchers have had to move out of those units to something more affordable.
I will say this for my part at least, if depending on where the manager lands with this proposal to make it a matter of policy about the relationship between maximum allowable rents and 60% AMI, and I can understand why there might be some downsides, right, to adopt a policy that would have an unknown budget impact. I would really like to make sure that we have some protections in place where we don't have individuals who are losing spots in CAFs because of incompatibility between our own housing programs in the county. So whatever policy measures might need to be taken to prevent that from happening, I'm interested in, would like to, in fact, hear more.
Could I follow up a little? Because I assume when that happens, we make sure they move to somewhere they can afford, because we don't want them on the street, right? So,
Right.
yeah, I mean, and I'm not saying
Yes.
it's still a difficult situation you'd like to avoid. But still.
Compatibility in our
Yeah.
public policy.
Yeah, yeah.
Mr. Christile is here, he could comment, but there are,
Jump at the opportunity, Mr. Christile.
but there are affordable housing developers who are raising their rents, and we are in a situation where we are having to move people out because they are not keeping the rents at the affordable level that they had previously been.
I mean, obviously, the idea is, I mean,
Can you unpack that a little bit?
Yeah. Because they'd be in violation of the terms of their site plan agreements or AHIF agreements.
well, we've got, I mean, the one case in particular is CAFs typically go up to 60%, but we've got CAFs that are up to 80% if they're owned by a nonprofit. And then there are a couple instances back, I guess, 2, 3, 4, 5 years ago where we had units on Columbia Pike that we had some up to 80% CAFs. So there are, you know, those units exist. Those, of course, would go beyond that. And I think in this case in particular, the one that Anita's talking about is Key Boulevard, which is, it's a CAF, but they've paid off their loan, so there's no agreement with them, but because they're owned by HC as a nonprofit.
Expired CAF.
Exactly.
Okay.
That's correct.
All right.
However,
It's
it's an expired CAF from our perspective, but because HC owns it, we count it as a CAF. And in that particular case, they could have, the rents could go from, if they're 50 or 60%, they could go up to 80%.
Okay, so at this point, I'm just going to suggest that there's a couple of very interesting questions you raised, which we do not have full data on, which we will get back to you on. And so also the question about having a policy on that, which is that I would say that I'm very, I like the idea a lot. As with most policies, I think that we would have to look at it every year depending on the budget situation, the fiscal impact.
Thank you, David.
In that case, Mr. Chair, it sounds like we can look forward to some follow-up maybe about how common this occurrence is and.
Right, and defining what this occurrence actually is. All right, very good. Before we go crazy and drive people into a panic. Any other questions about the housing grants portion of it? All right. What about permanent supportive housing? Are we ready for our commissions? All right, now is the time. Ms. Herman and Mr. Staterman, we'd welcome you up to the front. Please take your time.
You might want to back out, just Mr. Staterman is coming.
Okay, thank you. Hello. Okay. Well, let me put these in my bag so I don't.
Oh, take your time. And am I right, we don't have anyone from the Fiscal Affairs Advisory Commission today? Okay.
Should I move this one? You know.
This is good too. There we go.
Okay.
Okay, so today we, for every work session, we invite members of our
Absolutely.
For every one of our work sessions, we very much value the review and the counsel and the advice on the board's consideration of said department that comes from our advisory commissions who have subject area expertise or involvement in the particular area that we are working on at the time. So today we have William Staterman, who's the chair of the Disability Advisory Commission, and Ann Herman, chair of the Community Services Board, who are attending. Thank you very much for being able to come. We have invited, but due to scheduling and due in fact to this coming very quickly in the budget process, we weren't able to get representation from our Fiscal Affairs Advisory Commission, the Commission on Aging, and the Commission on the Status of Women, even though we may allude to some of the questions that they have sent us in anticipation of all of this. So, to begin, who would like to begin? Mr. Staterman, Ms. Herman?
It doesn't matter to me.
Would you like to go first?
All right, Ms.
thank you.
Herman,
I'll go first
thank you.
then. All right. Well, I thank you all for the opportunity to speak on behalf of the Community Services Board and my fellow board members. First and foremost, I want to thank you for including funding in the proposed budget to cover the gap created in CSB funding in anticipation of Medicaid expansion. That is really so important. Without a doubt, we all welcome that expansion, extending Medicaid to so many more Virginians. However, it would have been a tremendous shame if that needed expansion resulted in the loss of programs that serve many of Arlington's most vulnerable residents. As you have heard from Ms. Warren, we are coming to you today with 3 additional requests. So even though we know it's a difficult budget year, and we present these only because our clients need them so desperately. In anticipation of the budget realities this year, we have whittled down their many needs to just 3 requests. And we want you to know that we appreciate your consideration of raising the tax rate to be able to meet such needs. First, let's consider the addition of 1 FTE therapist to assist in addressing the increased number of clients being seen by the outpatient substance use team. And B, to respond to the growing office-based opioid treatment program. So it's the 2 parts. The office-based opioid treatment program is relatively new and has already been very successful. However, there is only 1 assigned therapist. The number of participants are steadily increasing. The program is set up to have both individual and group therapy, and the current therapist is working with all participants individually and running groups that are larger than they should be. The current therapist is also coordinating the program and doing case management. An additional half-time staff member would be able to assume some of the responsibilities and to help meet the needs of new clients. The other half FTE would be able to support the substance use outpatient team. With the addition of the state-mandated same-day access, the number of new clients assigned to this team has increased tremendously. In addition, expectations have changed in terms of ongoing engagement attempts and discharge practices. The current caseload averages 27. Next, the addition of a 0.5 FTE to increase the current psychologist to 1 FTE to meet the needs of clients with co-occurring autism and behavioral health. I know you've already been talking about this somewhat, but just to make a few more points on this. We're requesting this 0.5 psychologist to focus on these co-occurring issues. Adding the other 0.5 would allow DHS to leverage the vacancy, because there's a half-time position open, to leverage the vacancy to hire a full-time therapist with a background in this area. Individuals with autism spectrum disorder are at the very high risk of co-occurring mental health conditions. Studies show that between 50 and 95% of individuals with ASD also have mental health conditions. As the incidence is rising in the general population, currently estimated by the CDC to be 1 in 68, the need for mental health services has become more acute. This is a national and regional and local problem. A significant number of the new cases are very challenging to treat and require intensive staff time. DHS has made organizational changes and stepped up training for existing staff, but more targeted resources are needed. Community-based service capacity is very low. For example, Dominion Hospital will not admit children with mental health issues if they also have autism spectrum disorder. Regionally, referrals of individuals with ASD to the overcrowded Northern Virginia Mental Health Institute are rising, even though community-based services are the preferred option. And so, again, we look to have that additional person or additional 0.5 FTE to help out. Next, I want to speak to the 1 FTE mental health therapist for emergency services. With regard to this request, I want to point out that in fiscal year 18, the rate of TDOs, temporary detention orders, increased by 20%, from 491 to 613, and it still seems to be going up. What's important to understand is that if we could increase our staff at the Emergency Services Center, it would enable us at all times to cover both the center and have the opportunity to go out with the police on a call. This is sometimes not possible now. Well, it's often not possible now if there's not staff available at the center. So an additional person would be helpful in that regard. This would be a best practice. It helps to keep people out of jail. So let me close again with thanking you about Medicaid expansion and hoping that you will have the opportunity to consider some of these other requests. And we will plan to come see you to talk a little bit more about these as we go on in the budget season.
We appreciate it, Ms. Herman, but if you can stay around for a little bit in case there are any initial questions
Absolutely.
now, but after Mr. Staterman's presentation. Thank you.
Okay, well, good afternoon, Board and Mr. Schwartz, and thank you again for having me allowed here to speak. And we appreciate your continuing support of the disability community and population for all the years I've been here and before that, and many after that, I believe. So thank you a lot for that. And looking over this budget proposal, I was glad to see that the disability population is not affected by cuts too much, but I was, one thing struck me, which was in the note for transportation, there was a significant increase, somewhere around 147,000 for art and star, which raised two problems with it. First, art and star legitimately are related in that paratransit is related to fixed route, but they are very different for many purposes. And it's clear when they're different when you're thinking about cutting them as far as budget. If you try to reduce the R budget-wise, first you cut down lines. If you cut back star, that's the whole thing. The whole thing is all gone. So it's very different to group them together in that case. And it was not clear which amount of that money went toward art or star. Okay. And I can speculate that it was posed that it was all contractual funds. And I know there have been increases. And the contractual increases are very likely driven by the increased technology by contractors. However, and this is the issue, the STAR call center and the STAR program itself is using very, very old technology, extremely old. And I've mentioned this a couple of years. It's a very outdated. And the idea that they're funding contractors to get higher technology, which will increase their distance, will necessitate that STAR will require much bigger budget increase next year to get over that distance. And in the meantime, the service will deteriorate, and which we've seen it already doing a little bit for the last several years because of technology differences. And this just seems like a clear way to address a future increase in the budget by looking more at this increase and where it's going. And well, straight for that, a lot of people don't realize the difference between paratransit and art in terms of how they operate. And the differences, they're not the same at all. They are related, definitely. But when you reduce one, that's when you can really see the differences. And we've also seen several different contractual reasons that are being addressed elsewhere. And now the issue here, this is just more about the technology change and the likely change in the budget for next year. They will be related to this budget change. And that in brief is my comment. And I apologize, I don't have any written material to back it up, but I will send to you. I ran into some technical difficulties while I was getting it together.
No worries, no worries. Well, we'll look forward to those comments if you should have any, and we appreciate your talking about the transportation issues. Probably best for us to get into that later when we have Transit Bureau staff, but this will be a true test of my organizational skills, Mr. Staterman. I have made a note to myself to pin it for this conversation when we do have those folks in the room. That was the other big issue, that disability community transcends a lot of different organizations. Absolutely. So absolutely. It's hard to figure out which one, where to go.
No, we'll remember.
No, that's right. That's right. Thank you. Okay, so we appreciate you both, and let's have any questions for either or both. Both.
I had a question, if that's right. Yeah, and I don't know if it's for our staff or for Ms. Herman, and it's on the autism therapist. So I understand we currently have a .5 person, but that position's not filled. And is there a thought that part of the problem filling the position is that it's part-time, and if we went to full-time, we'd be more likely to be able to fill the position, or is it something else?
I think we want to defer to Ms. Warren to explain about this, if we may.
Of course.
So it's absolutely true that it is easier for us to fill a full-time position as opposed to a half-time position. It is also really challenging to find therapists who are licensed, who are able to navigate both the world of the autism spectrum disorders and behavioral health disorders. So even if we have a full-time position, it may take us a while to actually find the right person, but it would be a lot easier with a full-time position.
That's what I wanted to know. Thank you.
No, I'm not going to ask that. Any other questions?
I'll just add, yeah, I just want to add thanks to Ms. Herman and to Mr. Staterman as well for coming in. I don't have questions, obviously, went a little time to process these recommendations, but I appreciate them very much. And Mr. Staterman, appreciate your comments. I think you've given us some good notes for follow-up questions during the transportation session, and appreciate recently the conversation with the Disability Advisory Commission on that STAR service improvements area. So thank you both.
Okay. I'll do another question, if I might. Sorry, I'm still here. And I also, yeah, I think it's great, Mr. Staterman, actually, to have your questions, because we'll keep them in mind then when the transportation folks come, and that's always helpful. But back to one more on the opioid, substance and opioid use therapist. According to CSB, the average caseload is currently 27, and I was just wondering, what's the best practice supposed to be? Is there a best practice for caseload or a general range or something?
Okay, so having said that, you'd think I know the answer, but I'm going to turn to staff on this.
All right. That's partly why I'm asking these questions, because when you come
to
us.
Come up to the microphone, that will be useful information.
For opioid treatment, there really isn't a benchmark because the OBOT program is a specialized clinical program that involves a number of service hours per week. It's really on the level of an intensive outpatient program. So I can't really say that there's a benchmark in terms of the caseload, but if you could imagine one full-time clinician having 20 clients who each are getting 3 hours of service a week, that would be a pretty challenging scenario. So the caseloads for a specialized program like OBOT would need to be smaller than that. For standard outpatient treatment, which is part of what this ask is for this substance use outpatient team, caseloads of anywhere between 25 and 35 would be pretty standard.
Okay, so what you're saying, and I don't want to get into an argument here, is that there's a need, but it's not that's what I'm hearing, is that this is like acceptable.
The need is higher for the OBOT program, because we currently have one clinician for about 24, 25 clients. That average caseload there is really referring to the outpatient substance use team, which is slightly different from the OBOT team. The OBOT team is more of a specialized program. So the need, given that there's only one clinician on the OBOT team and about 24 clients, and the level of service intensity that's required for that program, it exceeds what one person can accomplish.
Thank you.
When I said 27, I was talking about the substance use, the outpatient team. Yeah. Okay. Not OBOT. But you can see that these demands of these two jobs, or the two half jobs, it's very high currently. Okay.
Thank you for surfacing that, Ms. Garvey, because I think I read it the same way you did. Anyone else? All right, Ms. Herman, Mr. Staterman, thank you very much.
Thank you.
Ms. Friedman, I think you efficiently went through your whole program, didn't you?
I did, and I just want to thank the county board and the county manager for continued support for our department.
Well, thank you for all that you do for Arlingtonians who desperately rely on the services that you provide. 50,000, it's important that we can't say that enough. 50,000, as much as we like to talk about Arlingtonians who are not in need, a significant number of our community need an array of services, and I'm glad that we're there to provide them. So thank you.
Thank you.
Mr. Manager, was there anything else we were going to present during our time this afternoon?
There is not.
All right, seeing no other business, this work session is concluded.